say the eyes are the windows to your soul, but they can also be the windows to your health, as it was for Renee.
When I became 28 years old, I was diagnosed with full-blown diabetes. You tend to forget that you have diabetes, and you do things with your diet, with your exercise that you shouldn't do, like not do it at all. About 2.5 years ago, all I did was bend down, pick something up, and there it was in my right eye. It looked like someone took a mascara brush and just did a big Z across my eye. I went for an eye exam to an optometrist who recommended me to Dr. Kaiser. I don't have much in the way of eyesight in my right eye. I am afraid that I will lose my sight totally. It makes me angry at myself that I didn't take care of myself better. Follow the doctor rules and regulations. It's worth it, and you won't realize it until you've lost what you've got.
She has developed advanced diabetic retinopathy. And what happens in that situation is you get blood vessels that grow on the surface of the retina, and they can break open and bleed. So in this case, she had a pretty big bleed into her eye to the point where she can no longer see out.
So I want to make sure I have good laser in all 4 quadrants out to the far edges of the retina, and I'm actually killing off tissue that doesn't have good blood flow. All right, we're done with the laser. Now we're going to do the vitrectomy, which is the portion of the procedure on the other eye to remove all the blood and debris and treat all the diabetic retinopathy that's inside the eye. So I'm going to mark exactly where I want to go in. There's a perfect point where you can enter the eye between the cornea and the retina without causing damage. As I remove the blood, we'll begin to see the outline of the retina. So now I'm removing the gel from the far edges of the retina. Then I'm going to add laser to try and prevent this problem from occurring again. I'm very pleased with the way the surgery went, and now we're going to have to wait and see how she does. I expect good things.
We have Renee join us from Pennsylvania via Polycom. Also join us is Dr. Rick Kaiser from the Wills Eye Institute in Philadelphia. Welcome to you both.
Thank you. Thanks for having me.
And we're always talking, Dr. Kaiser, about the diabetic complications folks have to worry about. Vision is a major one. How does diabetes take you down the vision problem pathway?
I think it's really important for people to understand just a little bit about how the eye works. So we have a model here. Light comes in through the front, goes through the lens, and it goes through a cavity in the center where there's a gel, that's the vitreous. And then there's the retina, which lines the whole back wall of the eye. It's like wallpaper in a room. In the center of the retina is an area called the macula. That's your bullseye central vision. That's what it gives you all your fine focus. And unfortunately, that's where diabetes centers its damage. That's where it focuses on.
So much like when we talk about people with macular degeneration, they lose that central vision. Same thing's happening for these folks with diabetic
Absolutely.
retinopathy.
It targets that central vision. And that's what we brought some pictures here. So if now we're looking straight into the eye, we're looking at the back of the eye, we're looking at the retina, and specifically we're looking at the macula. And so this yellow disc is the optic nerve which connects the eye to the brain. And this center area, this is a normal macula. You want that orange pigment there, this is normal. And I think it's important to see normal so you can understand disease. Here's a case of someone who's actually had diabetes for about 10 years. There are hemorrhages here. There are different stages of this. This can progress to the point where this stage causes a loss of central vision.
And do we have an advanced one? Or
We do.
Because this is where you really run into massive problems. We've switched the side here of the eye. Just so we want
right.
The optic nerve.
Yeah, we're looking at a right eye versus a left eye, but it's the same principle. Here's the optic nerve that connects the eye to the brain, and this is the proliferative stage of diabetic retinopathy. This is the most aggressive stage. Basically, what happens is new blood vessels grow sort of like weeds in a garden, and they pop up in different areas. But those those vessels are very fragile. They can break open and bleed, and you can see areas of blood that are starting to cover the retina here. And those blood vessels can cause scar tissue, and they can actually detach the retina.
And so she had actually bled into this area in the back, and this is where you were, in this area.
She actually bled through the entire central cavity of the eye. So the entire central gel was filled with blood.
And you were in here taking out that blood with
gel.
your instruments in the surgery.
And after we removed the gel, then I had to work on the scar tissue, which was on the surface of the retina. so that the retina wouldn't detach and wouldn't lift up.
And so this was a week and a half ago. Renee, how are you doing?
I'm doing wonderful. I'm still in the process of healing, but Dr. Kaiser has informed me that my eyes look great and that I'm looking forward to a full recovery.
So obviously, Renee, people take their vision for granted until they lose it. So you expect this will probably change your life somewhat?
Definitely. This has been a big wake-up call. I could have lived in darkness, and that caused a lot of anxiety and fear. I'm really lucky. I was given a second chance, and I plan to take my diabetes more seriously and take better control.
And in the end, diabetes, type 2 diabetes, is an illness largely under your control. Quite simply, move more, eat better, and eat less. One way you can do this, just real quickly, plate your snacks out. Because if you're eating all these out of the box or the bag, you're going to eat more. And then when you're doing whole grains, go ahead and choose foods that aren't going to just skyrocket your blood sugar levels in each and every meal. It makes a huge difference. So go for nuts instead of just, say, plain white bread. Huge difference in your long-term outcome. And Renee, we wish you the absolute best of success and luck. And Dr. Kaiser, great work. Thank you so much for having me. This is the eyes of the windows to your